is $60,000 less than the last. That's what we project the Enfield general fund balance will be at the end of 2024. Why? Because, for lack of a better term, we have to rob the fund balance to pay our day-to-day bills. Rob it to the tune of $60,000 for 1 year alone. Why do I bring up these numbers? Because today your committee will consider a resolution that would direct administration to invite municipalities to enter into a memorandum of understanding regarding cost sharing for what's now called the Pilot Rapid Medical Response System, or PRMR, better known as the fly car service. Department of Emergency Response models have suggested up to 50% municipal funding for the fly cars. And with 50%, options that could cost Enfield $29,000, $38,000, maybe even $58,000 a year. Where'd that money come from? Out of our meager fund and dwindling fund balance, for sure. Today's resolution says the memorandum of understanding would need to be in place before the fly cars start rolling. Now, there may be a memorandum, perhaps, but I predict within the towns there'll be a whole lot of misunderstanding. Speaking as one town board member, I wouldn't vote for spending that kind of money. If Enfield needs to spend 58 grand, I'd say we should hire our own person, put that own person in our own firehouse with our state-of-the-art fly car, and answer Enfield calls ourselves. Someday, some way that is, somehow, something that started out very good went terribly wrong. But then the bean counters took over. We had a good idea. I lobbied for it here, perhaps harder than anybody else would. But those bean counters took over. How much can we squeeze out of the towns, they said. And by the way, leave the city off the hook. Please rethink this today. Send the legislature a different message. We, the rural towns, are flat broke. We can't bankroll even 50% of this cost. But with up to $72 million in fund balance, you, Tompkins County, can do so. Please fund the fly cars today with county money. Thank you.
Thank you. Is there anybody else in the room or on the screen who wishes to address the Public Safety Committee? Okay, seeing none, we will proceed. Are there any changes to the agenda? Seeing none, we have minutes from October 19th, 2023. Could I get a motion? Veronica moves, and seconds to put them on the floor. Any questions or comments on the minutes? Are we ready to vote? We are all here, so we can do a show of hands. All those in favor? That's unanimous. Great. The chair's report. We are just flying through our agenda. This is great. I had just a couple things. I was hoping to talk about our priorities that we established for 2023, but I think we've got a lot to do today. So I will hold that for our December meeting. But we are fortunate to have a couple guests with us today on screen. I believe Frankie and Zoe are there, and maybe Frank Krupa from the Whole Health Department. And I'd welcome them to the meeting. And the purpose of them coming today, I asked if they could talk to us a little bit about their thinking on how we might be reconsidering or doing a different way of tracking overdoses in our community. So welcome, and I'll turn the floor over to you guys for a few minutes, and maybe then there'll be some questions.
Sure, I'll jump in real quick, Rich, and make some introductions. First, thank you for inviting us to talk about this subject. Zoe Lincoln and Frankie Pirtle are working on this project. Frankie is a public health fellow with the department, and so we've been fortunate to bring on several fellows to work on particular projects, and this is one that was important to us, and we were glad to have that resource. Zoe was a previous fellow, which we've been able to hire in as our first ever whole health planner, and her role is to support me on our special projects that we have going on that needed additional resource. So the two of them have kind of been working this project, and want to kind of share where we are and where we're hoping to go with you all. And then, you know, happy to take any questions or input about the work that we're doing. So with that, I'll turn it over to Frankie and Zoe.
Thank you, Frank, and thank you everyone for having us here today. I've been super excited to work with Frankie on this project, kind of continuing some of the work that I started initially as a fellow. I'm going to let Frankie get things started and talk a little bit about her work and some of her visions for the work. And I'm here to support and answer any questions about things that may have been done when I was a fellow, and here to support Frankie as well. So I'll turn it over to her to get things started.
Hello, everyone. It's a pleasure to be here. Thank you for having me. My name is Frankie Pirtle. As Frank said, I am a public health graduate fellow here at Tompkins County Whole Health. I did prepare a short slideshow presentation, and I'd just like to go over it with you all. So let me go ahead and get that set up.
Frankie, just for the benefit of those here in the room, could you speak a little bit louder, because our audio is just not quite working very hard here today. Thanks.
No problem. Can you hear me okay now?
Yeah, that's better.
Okay, perfect. So as I mentioned, my name is Frankie. I'm a public health graduate fellow. And so I just wanted to go over a little bit of what I am working on currently, because a lot of what I am working on is surrounded around suicide and overdose prevention within Tompkins County. So one of the things that I am currently working on is updating our dashboard. And so where I kind of am with that now is trying to find significant trends and indicators that we can use in our dashboard. And so we're really trying to look at some of the things that we already have readily available. And so we're looking at state and local resources. And then also, because from what we have now on the Tompkins County website to where we're trying to get it, we also have the understanding that we have to possibly look at other counties and other resources and see what they're doing as far as what's on their dashboards. So we are looking to other counties for inspiration and information, just so how we might be able to contribute different data pieces to our own dashboard. And then also we're networking with other organizations and partners to help with data sharing. And then also on that, to increase our bandwidth and focus on the subject, we do also have a few other fellows who are helping me work on this. And so we're really working on the data extraction, the synthesizing of the data, and then also interpreting and visualizing that data in a way that's appropriate for the community and a way that they'll be able to actually look at it and make sense of it all. And then also just some of our outcomes, you know, the reasons why we're doing this and what we're hoping to achieve. We're really looking to make sure that we're improving that line of communication to the community and then helping community members to make their informed decisions. And then also just enhancing some of the awareness around opioids and substance use. And then we're also understanding that we are a key resource for the community when it comes to information. So we're really trying to prioritize the impacts and the meanings behind the indicators that we decide to use and tell our story. And then also we do have a few surveys that we're using as data, and we want to use that because it is community feedback. So we want to lean into the interests and the wants and needs based off of what the community has told us in those surveys. So we're also using that in order to kind of drive what we're putting into the dashboard. So far, those are some of the main and key pieces that we're doing so far. And I'd like to open up the floor to questions and answers in case anyone might have anything. And I know Zoe and Frank are more than happy to jump in and help as well.
Okay. I don't know, do any of the committee members have questions? I can jump in, but I'd like to give you guys a chance first.
Can we back up to what the overall goals are? Was there?
The previous slide, or?
Yeah,
I see the outcomes and I'm trying to connect it to what the intentions were.
So on the previous slide here. So the previous slide, it just kind of goes over what we're doing. So far, we're really trying to update the dashboard that we have on the Tompkins County website. And these are just some of the processes that we're going through at the moment. And then the outcomes / achievements and what we're hoping for is on this slide here. And it's just, you know, informing the decisions of community members, making them aware, and then, you know, figuring out those impactful indicators that we're going to use in the dashboard in order to kind of what's the word I'm looking for here? To really make sure that we're engaging the right way with the community members and also including things that they responded in the survey saying that they would like to see.
Thank you.
Yeah, Ann? Yeah, use your mic.
Frankie, I'm just wondering, when you leaned forward before, we could hear you better. So I'm just wondering if you could try that. I just wondering if we're having a lot of trouble hearing you. So
Sorry.
that's okay. I'm just wondering if maybe your computer mic is picking up versus your headset, because leaning
I
forward,
hope not.
I'm not sure, but we're having a lot of
Yeah.
trouble hearing you. But I mean, we can hear you, but just a little bit
Were you
low.
able to hear any of the presentation?
Yes, it's just kind of quiet.
Okay. If I need to speak up more, just let me know and I can do that.
Thank
Okay.
you.
Is there any?
When we had a conversation a couple weeks ago, and one of the issues we talked about, if you recall, was the issue of confidentiality of data. And that really creates a structural issue with trying to gather information and to share it. And one of the conversation points we had was using whole health as the clearinghouse to collect the information, confidential medical information, but then to allow you guys to aggregate it and share it with the community. And I just wanted to make sure, is that part of what you're thinking is the plan?
Yes, so as I'm going through, are you guys able to hear me okay now? Just want to make sure.
Yeah, I can hear you now.
Okay, so yes, as I'm coming up with the indicators, that's also a part of it too, as we had in the conversation a few weeks ago, is, depending on that threshold, the number of what we have, it's important to make sure that, discretion is used, privacy is used, confidentiality is considered. So that does go into the indicators. So say I decide to choose a certain indicator and it seems that the indicator that I'm using might be going against the confidentiality that we're trying to achieve, then unfortunately I would not be able to use that indicator, or we would have to find a workaround. So that still stands. The conversation that we had a few weeks ago, it still does stand in the process of me coming up with what we're going to put on the dashboard.
Okay. What kind of timeline are you thinking about in order to be able to roll something out?
So as far as timelines go, I think that it really is going to depend on, because like how I said, we have people that we're trying to bring in, help out with, because, at first it was just kind of me and then some of the other people that we have here at the health department working on it. But now we have other fellows, and then we're also trying to figure out other partnerships and who else we might be able to have with data sharing. So at the moment, I cannot put a definitive timeline on it. But like I said, throughout my fellowship, this is something that I will be working on. So I'm hoping to at least have something put out on the website by the time I conclude my time here as a fellow.
Okay, thank you. Veronica.
Yeah, thank you. Thank you for your presentation, Frankie. I confess that I was not familiar with our county's the health opioid dashboard coming into this, but I'm looking at it now, or I'm looking at the opioids page, and then I've also clicked through to the New York State opioid data dashboard by Tompkins County, and it's tracking 77 different indicators. Our county page, am I understanding it correct if I say that the county page now is tracking 2 indicators, 911 calls for overdose or poisoning and drug-related deaths?
Yes, that is correct. And that just goes into we understand that, there are improvements and there are additional indicators that we can put up on the website, and that's what we're working towards.
Totally, yeah. The 77 number on the state website is a little overwhelming. Can you give any guidance on what, I know this is what you're working on, but what indicators do you think might be most important, or what is more or less useful than a member of the public might think? Or how should what should I be looking at when trying to get some info from these dashboards, just as a person?
I can jump in here, Veronica. I think there's there's several challenges with the state data, both the quantity as well as the timeliness of it. Much of it is older data. So that's part of what we're trying to build, is to pull out what we think is most important that we have access to locally. So we're able to then build a dashboard that will have local data that, as Frankie alluded to, is readable, comprehensible by the public and our partners, and is useful. We're not there yet. And honestly, the state stuff we supply because we want to give everyone access to whatever data that we have access to and point them to. But it really isn't in a format yet that we can, really recommend. I think if you give us a little bit of time, the goal of this project is to really answer that question that you just asked. What should we be looking at, and where's the best data points that we can get the answers to that?
Makes sense. Thank you.
Okay, well, maybe we could invite you guys back, say in sometime in the coming year when you feel you've got progress to report on. If that would be okay, Frank.
Absolutely.
Okay. Well, thanks for your time and thanks for the presentation. Really appreciate it.
Thank you all.
Okay. All right. Moving on, we have county administration. And Lisa Holmes is with us, and Bridget Nugent. Welcome to you both. And I see you have a resolution. You have a few resolutions. So
have a few resolutions, and we also have an update from the Community Justice Center. And
okay. How would you like to proceed? Do you want to get the resolutions dealt with, or do you want to go to the CJC?
I think if we start with the CJC, it may provide some context for one of the resolutions at least. And we have Mona Smiley and Matthew Davids with us from the CJC.
Hey, welcome.
Hi, good afternoon. Thank you. Can you hear me okay? I know you're having some issues with the audio. Is the sound coming in okay?
Your voice is coming through okay.
Okay. Well,
so.
I've been told I have a big mouth, so here we go. I'm going to give you an update really quickly on a lot of good things that are happening with the CJC right now. So I'll start with the community resource hubs. Broughton has really taken off. We've helped probably, if I had to think about it, over 15, 20 people, whether it's information or services, referrals, things of that nature. Enfield's a little slower, but we're still out there. And then last night, I was invited to the Lansing Town Board. They are interested in hosting a resource hub in that area. So I did a quick presentation to them last night, and they are identifying possible sites that would be the host of the resource hub out there. Community healing, the mural and the project with the Southside Community Center's Black Girl Alchemy and the History Center and Downtown Ithaca Alliance has started. It's taken off. The artist has been out there, sketched out the actual mural on the wall, and the young women and gentlemen from BGA will be helping with some of the painting. So if you're out and about and you want to stop by the Commons, there's quite a bit done already. There will be some sessions this afternoon, actually right now, until 4:30, and then again Monday and Tuesday, where we'll see some community members joining the Black Girl Alchemy and the artist, who is Terrence Van and Anne Marie Zwack, putting some paint on those walls. So it's pretty exciting. There was lots of roadblocks, but we overcame them, and yeah, it's exciting to see that going in. The other part of community healing is we've created a newer working group that has some law enforcement, I'll say adjacent members that are now part of our working group. So Matt Van Houten and Kathy Zoner have joined us. We had our first official meeting this morning with them. Very good meeting. We're going to make this come to fruition. It's going to be good. So we have our community healers plus the two of them, and we're already planning a community event. The advisory board is doing very well. We have elected a chair. So Dr. Susan Eschbach is our chairperson for the advisory board. She's taken on this role and took off running with it, with setting some meeting cadence and some standing agenda items that we're working on. So I'm excited for that. We also have the recruitment and retention plan. So we've been working with our consultants and they've completed some interviews of human resource representatives in both the city, the county, law enforcement. There is an interview with law enforcement that's on record, and then also our community partners with one being Cornell, a human resource specialist, and then a community member that was on our working group. And we are on track for our December deadline to receive a report from them on strategies for recruitment and retention. Culturally responsive training has a pretty active working group, and we are working on establishing a curriculum. So we have a regular scheduled meeting also. And I don't think I missed anything. The data dashboard is, it's coming along. Matthew is actually gonna, I'm gonna turn it over to him in just a second. He's gonna walk us through the development and the creation of that. I would like to say that one thing that we have coming up next is going to be on traffic safety. We're in the process of finalizing the RFP that's going to go out. So that'll be our next plan that we're going to take off on. Matthew, if you would like, I will turn it over to you and you can share our dashboard.
Thank you, Mona. Just to kind of make sure everyone can hear, is everyone able to hear me as well?
Yes.
Thank you. So firstly, thank you for the opportunity for us to share the concept of a community dashboard. I will share my screen just to bring that on up for everyone to see. We have taken the time to brainstorm around how data can be shared in a meaningful and sustainable way. We aim to have a transparent view of the types of data that we have been tasked to report on. So I'm about to scroll down in a moment, but just to give a little bit of context, this dashboard was prepared in OpenGov, and OpenGov has been identified as the platform for our data publications, as well as other functions across the county departments. This platform, as with any other presentation software, it has its strengths and limitations, but it does allow us to build context around the data that will be displayed. The county has chosen and invested in OpenGov, and it will be used to align efforts in building transparency into county operations and the county budget expenditure. And the CJC will focus on the data related to public safety and the criminal justice system. So with that being said, I have to emphasize that at this stage, what I'm about to show you in these charts and the information on the page are concepts in development. We welcome input from all stakeholders and partners, and we value input from the community to help improve our efforts. And although the data has been pulled from real reports, what we will see today might not be what will be displayed when this page becomes available to the public. What we are trying to do is to show how someone from the public can use the data that's presented here. So I'll start to go into the details of the page. Firstly, we are able to build or provide some context to the data points. Specifically, the wording will not lean to any rhetoric, but rather explain what the viewer will be looking at. The dashboard is broken into these three sections. So it would be the theme would be around the community dashboard, and that would focus. This section will focus on strongly on the dispatch center end of things and the subsequent steps that follow directly from a call. So the involvement of law enforcement. The second section will focus on the care team, and I'll get to that in a moment as well. And then the third section is what is up for a discussion a bit later as well, but it's the criminal justice system, arrests and outcomes, and that relates directly to the data disclosure plan. So the section, what I will just try to do just very briefly is just to jump in and out of some of these charts. So I know one of the concerns that was presented was the fact that we wouldn't want to have the aspect of arrest being made out of context, and so I just took some of the data from the reports that are submitted on a monthly basis from the sheriff's office and just put them in one chart, and that reflects the amount of incidents that they are involved in, and then also the yellow sections of these stacked bars are of the stacked columns they represent the arrests. So it is a small number, but as I click into the section, this is what someone from the public would be able to. This is how they'll be able to gauge with the charts and with the data that's available. So this is one example. I just want to, just for the sake of time, and we can get back to this unless there are any questions, you're more than welcome to stop me at any point.
Oh, you're doing great. Just keep explaining. This is good.
Thank you. So I think when we look at the care team, that would give a better picture of what we would like to do and what we plan to do. With the care team, we are thankful to DUA for providing data on the dispatch end of the care team interactions. And this has helped us to put together some data points regarding the care team's deployment. So, and in this section, we have examples of how the viewer of this publication can get into a statement and find more information about predefined views. So we have one type of view, which is similar to the one that I just I showed a moment ago. Someone has access to these data points, and I'll just touch briefly on one or two aspects, including the geocodes. So if I just go back and I go into some more views, I wouldn't go through all of them, but I just want to point out some really important things. So OpenGov has its strengths and limitations. What we are able to do is present predefined views. Whoever interacts with the page or with the views, they'll be able to kind of play around with once again predefined data points that we are providing. And then I just need to, if I go into one of the points of discussion being the map and what it might show for interactions out in the field or incidents out in the field. What we are able to do with OpenGov is to give kind of like a grid form of where incidents might happen. So you'll see with the coordinates, normally they would be to 4 decimal points, but in this case, we can use them to 2 decimal points, and they can still give us a fair picture of where of when interaction might have happened. And bearing in mind that we are focusing on the care team, and we are aware of the different aspects surrounding confidentiality and protecting all parties involved. Then one more point to mention on this though is the viewer is able to go in. Excuse me.
Hold on. Ann Foreman has a question.
Oh, sorry.
No worries. Thanks for this presentation. I just wanted to ask you something in the map section here, and there's a lot of detail. So I really appreciate this getting out, information. Will the map be publicly available? Because I'm just thinking that could be, if you zoomed in on that could that's like, you could probably see various, exact locations.
Thanks, Anne. So, the way that the data is received, it does come in the form of having the locations and not necessarily the names of the locations where they take place. So, but what we are able to do is just to make it instead of completely removing the ability to plot this on a map, we move from, normally this would be, as an example, 0.34, maybe 5.6 or something, but we're just rounding it off to the nearest two, so at least when someone clicks on an area, it will give some information, but not enough to be able to locate to an exact location. I think one of the things that we are able to do as well is, if we go back to the story, maybe perhaps the story section, or we will be able to make sure that people understand it as well, that these are not exact locations, but they are kind of in a general area.
Okay, and Veronica has a question.
Yeah, just to get a little better sense of what you were saying, how large in distance is like 0.01 degrees of latitude or longitude, like the precision to which you're measuring?
As an example, I think if we say that the point that we're looking at right now,
actually, I can kind of see, I think, would it be the space between some of those closest spaced dots that kind of look like they're landing on a grid?
Precisely. So if that's correctly, that's precisely it. In terms of, if I had to zoom out, you can kind of see they plotted on a similar line, and that's why the coordinates are also, they kind of fall on like almost like a grid compared to it being like very specific. So if I had to zoom in, this is really within the heart of the Dryden's main area, but then this incident could have happened like anywhere within this radius. So it's not precise. The place like Dryden is pretty dense as well compared to other places around Tompkins County. So whoever's looking at this wouldn't be able to pick up with the data in the table where exactly that an interaction might have occurred.
Okay, thank you. Any other questions? All right, why don't you keep going?
Thanks, Rich. I won't be much longer, but there are some important points because I think it just addresses a lot of our concerns. So someone is able to download the information that's in this table, but the important thing is that these are predefined fields, and so we are careful on what we would share with the public. So we wouldn't want to put any civilians, public servants, or officers at risk. So just as in someone being able to download a plotter or any other type of data from different sources, this is available, but it wouldn't put anyone at risk. We try to focus mostly, some of the other types of data we might collect might be a little bit more general than this, a little bit more aggregated. But then I'll just quickly jump, if there are any other questions regarding this, I'll just quickly jump back to the rest of the dashboard or this page. So the third section, as I mentioned, is the criminal justice arrests and outcomes. This focuses on what has been previously discussed as the data disclosure plan. And one interesting thing one example of how we were able to use this. So when I refer to, the yellow part of a stack column being focusing on total arrests, those arrests can be broken out into the categories that they fall under. So as you can see, the blue section is mostly these will be misdemeanors, which naturally would make up most of this type of data set of total arrests. And then we have felonies, active warrants, DWIs. But the concept would flow, the same type of concept would flow from section to section. The way that the data would be available to the public would be the same. And then if we're allowed to move forward, we will be able to build out these data points specifically based on the data disclosure plan. And so that is one section, but in the final section, I just need to show that in an effort to show reciprocity with our partners, this is an example of us being able to direct the viewer to different dashboards. I'll just very quickly show you that we're able to open the IPD's dashboard, and I'll just leave it at that. And yeah, this can be similarly done for other parties involved with their data sharing, and it's critical to have. That's why it's critical for us to have accurate data based on what other departments are reporting as well, so that when someone jumps between pages, they'll see the same data that might be presented in a different way depending on the types of overlap. And in summary and conclusion, to address the concerns about the concerns about privacy and security, someone who views the data, as I mentioned, they can access but only what we upload. So it comes in the form of an Excel sheet, but the templates will definitely not contain any data that might compromise anyone. And on the topic of sustainability and feasibility, I think in closing, I can just say that, as you all know, we are sticking to the principle that we would like to share or work together with all parties concerned to get the best result out to the community and the broader public. The CJC does not own any of the data, which does leave us dependent on our partners. And for the dashboard to be sustainable, we do need to ensure that it is shared consistently and in good faith. And hopefully we can reciprocate assistance where possible as well. And I'm open to any other questions that might follow. Thank you very much.
Matthew, thank you. And Mona, thank you. This is an impressive amount of work. But I'd like to open it up to see if anybody had any questions or comments. Ann.
Yeah, thank you for all this work. I really like that it's accessible in the way that you could, look at different indicators. You can look at different parameters, time-wise, and all kinds of things. So I really like this. And so one question is, I don't know if you have this answer, but is this readily available, or are you looking for later expanding the dashboard to include information from other municipal law enforcement agencies in the county?
Thank you very much for that question. I think it really depends on the plans that are involved. As an example, when we speak about the care team, we do have parts of the process that they are involved in, so we are able to share that data. I think that would be up to for discussion within our project management team, but I do believe, and our working groups, but I do believe we are closer rather than further if we're closer than we are further away from being able to make this available to the public.
Okay. Anybody else? All right. Well, again,
my question's for you.
Oh,
So we can go on.
Oh, so we can go on?
Yeah, well, we don't need everybody.
Okay. Again, Matthew and Mona Lisa, thank you so much for your work on all of this. And we're going to be considering a resolution, I think, in a few minutes on it. So we'll go from here. So great.
Thank you very much.
Resolution.
Please.
Now on to the resolutions. And if you want it to stay on the topic of the data disclosure, we can take that one first, and then the others are.
Why don't we do that? Why don't we get to that one? And so we have Resolution D, Reimagining Public Safety Requiring Data Disclosure on Arrests, Prosecutions, and Case Outcomes, ID 11852. Could I get a motion on that? Ann moves. We have Veronica seconds. Okay.
So I think since the last time this resolution was discussed at the committee.
Actually, I'm sorry, point of information, which version did I just second.
I assume you're doing the revised one that's sitting on our desk.
Yes. the
Okay,
revised,
great, thank
yes.
you.
Good point, Veronica.
So, yes, that's the one I was moving.
So, so since the last time this resolution was discussed at this committee, the stakeholders, county staff met to discuss some of the concerns that were raised at the committee, as well as some issues that were identified around data ownership and the various stakeholders. And we've attempted to address many of those concerns and hopefully come up with a version that is mutually agreeable to the parties. And that's what you have before you in this revised version. I should also state that we did have discussion around the data examples, the samples that were attached to the resolution. Those have not been updated, and I would just state that they are still a work in progress. We did not have the opportunity to revise those. It's really there are still a couple of points on those samples that we are still working on, but the resolution and the direction that we're going in is captured in the resolution itself.
I guess I would just want to say thank you for all the time you've spent on this and the time you gave to me to meet with you and staff from the various departments to have the discussion about context and the limitations of the data that we have available to us that we can draw from. And I also want to say thank you for the sort of informal commitment I think we're all sharing here, that we want to try to find better ways to collect and share data so we get a fuller picture. You know, that what we have now, I'm not entirely satisfied with, that it really tells a member of the public enough for them to draw conclusions, but we live in an imperfect world and here we are. So I think this is as good as we can get to this point. And again, I appreciate the time and effort put into it. Committee members, question, Lee?
A comment and a question. The presentation that we just saw provides some greater context, and I appreciated what other areas you're working in. So it kind of relieves me on some of the points I had at a previous meeting. And it looks as though you're headed in a direction that's going to give us some broader context. My question just is specific to how you've written in the last whereas on the first page, when you refer to cases, is that cases meaning the arrests? So it's very specific.
Yes, that's correct. Everything in this particular resolution begins with arrests.
Okay. And the incidents meaning where the alleged crime took place, for which the arrest was made.
That would be correct, yes.
Not necessarily cases meaning all the interactions by law enforcement that don't result in an arrest being made.
Correct. That would be seen in that overall dashboard that you saw before, where people would enter in, view all incidents through the community dashboard, then have those more drilled down examples, the third of which that Matthew showed being the one that includes arrests.
Thanks.
Ann?
Yeah, I just wanted to reiterate what my colleague Lee Shurtleff just said. We're headed in the right direction, and I feel really good about that. As Rich John said, it's not perfect, but you know, I really do appreciate everybody working on this and taking the feedback. I think you know, increasing the transparency to the community, another byproduct of that as we do that is that we have more data to kind of look at. So as we're tracking more things, like we talked about for, you know, tracking things with the opioid crisis, this gives us more ways to readily available look at information ourselves, whether it's legislators, department heads, members of the community, members of law enforcement, and others. So I want to thank everybody. I feel, again, we're headed in the right direction.
Mike or Veronica, you have anything? Don't have to, but okay. Yes.
I guess I'll add my appreciation for all the work that folks have done on this and finding something that's, yeah, helpful and moves us forward and that everyone can be at least okay with, it sounds like.
Okay, are we ready to vote? Those in favor?
Rich, were you gonna offer an amendment?
I was going to, actually, let's hold off. Let me explain that. I had proposed to add this whereas, and I got an email from Jen Olin, the undersheriff, indicating that they're still having conversations about data ownership with all the various police agencies. And they wanted to hold off adding something like this right away, but the intent is to have some sort of overall explanatory statement later on, but we're going to have to, that's part of the continuing growth. And so I'm willing to live with that and not offer my amendment. Certainly somebody else on the committee could offer it at this time, but I think we're okay where we are at. Yeah, Veronica.
I'm not offering it, but I just want to point out that like the first part of it is saying that the data disclosures should include the total number of incidents where police agencies respond, and that, well, we saw an example in the dashboard, but that does seem to be in the revised version of the resolution in the the thing where it lists the things we're disclosing when it says tracking arrests. That new parenthetical dashboard should contextualize arrests alongside the total number of officer interactions with the community.
I think we're okay for now. I had written this without, anyway.
Sure.
Okay.
Well, and as I alluded to with the broader context, when you consider the community dashboard that's being developed, that's going to capture a lot of, I think, where you were headed with this amendment.
It is. This is very positive what Matthew's worked on. So, okay. Are we ready to vote? All those in favor? That's unanimous. Look at that. August to today. There. Good. Okay. Lisa, you had two other resolutions. Do you want me to put one of those on the floor? Recommendation of adoption of 2024 countywide shared services plan, ID 12027. That's resolution B. Can I get a motion on that? Veronica moves. Lee seconds. Thank you. Okay, so do you want to speak to this, Bridget, or?
Sure, be happy to. Good afternoon. So as you're all well aware, we've been working with the convened shared services panel over the course of the year to put forward what we would be including in our 2024 shared services plan. We've moved through the required meetings of the panel. We've moved through the required public hearings, and now we are on the next to last step, which is allowing the legislature to review and add their input to the draft plan. So this has gone through the Government Operations Committee. It's come to you all considering it's the Rapid Medical Response Program that is being included in the plan. This will be on the first meeting in December's legislature meeting, and then we will have our final shared services panel voting meeting December 11th. So they will use whatever input you all provide to perhaps incorporate into the plan before they have their final vote, and then we submit it to New York State before the end of the year. So this is the mechanism through which we are asking you to review the plan and provide your input.
Hey, Lee.
Going back to our last meeting, and I think I asked Lisa point blank on that, as far as moving forward with the shared services plan as this is proposed, it does not delve into the cost sharing, nor is it obligating us to any particular funding model. This is what is put forward as a shared plan, and details will be worked out, and we're all optimistic that I get funding to cover the first year.
Okay, Ann.
So I see we have a resolution later about negotiating a memorandum of understanding regarding the rapid medical response. I would prefer that this, the draft said that it says right now, we will consider, it's on the first page of the draft plan. 1, 2, 3, 4, 5. The fifth paragraph, last sentence says the county will need to consider cost sharing or other arrangements with municipalities to support ongoing operational expenses for year 2 and beyond. I would prefer it to say may rather than that we will, because I don't think we've decided, and even if we
I guess you could interpret that the cost share is all on us. It's 100% county cost share, but I don't know. I don't have a problem if you want to say may there.
We could say may, okay.
But that's up to county administration. It's their supporting report.
You can include it as one of the pieces of input for sure.
Okay. And again, what this resolution does is allows us to proceed to file the grant application with New York State. It's really not addressing the discussion we may or may not have with the other municipalities. So I'm ready to go forward, but I guess anybody have any other questions or comments on this one? All right. Now I'm trying to remember, we moved and seconded. Yes,
we did. Can I just, Annie, can you point out where that word was again? I'm sorry.
Sure. So it's packet page 11. 1, 2, 3, 4, 5. The fifth paragraph, last sentence. The county, it says the county will, and I'm proposing to change that to the county may. I don't know if we can change it in this, or we're suggesting this gets sent back.
Correct.
So it's not going to be changed in our document.
Okay.
That gets put before the legislature.
Wait, package page 11?
yes.
Back of page 11, yeah.
Okay.
So it's not in the resolution itself, it's in the
actual
plan. Yeah.
Actual shared services plan.
All right. Are we ready to vote?
Yes.
All right. All those in favor? That's unanimous. Great. Okay. Let's go get some money. We could. And then we have resolution accept 2023-2024 New York State Department of Criminal Justice DCJS Discovery Grant ID 12010. And Ann moves, Veronica seconds. Do you want to speak to that?
Sure. This is just a resolution to accept as it states, the Discovery Reform Grant funding that is received and distributed through the District Attorney's Office. The Sheriff's Office and Department of Emergency Response also receive a piece of this funding to support their discovery reform efforts. It's my understanding that this had already been budgeted in the 2024 budget, which is why you don't see the revenue and expense lines in here.
And my understanding is this was a state response when they set additional requirements onto local agencies. Okay. And we had a motion and a second on that. Any questions or comments? Nope. Ready to vote? All those in favor? That's unanimous. Good. Okay. Are there other items for county administration?
So thank you.
Okay. And then the Sheriff's Department is up next, but I think the sheriff is engaged elsewhere and I don't see the undersheriff. So let's move on, and if they are able to attend, we'll come back to them. So next up is our district attorney. Welcome, Matt. How are you?
Thanks, Rich. I'm well. How are you? The biggest thing that's happening, I think, in my office is that we are within days of launching our dashboard. We are literally just working through a slight technical issue. It's not really an issue, but it's just more of a formatting issue with ITS. And then our dashboard will be launched and you'll be able to see what's there. And we certainly will commit, as I've said in the past repeatedly, to share our data in good faith with the CJC and our other partners. And specifically, the arrest data is data that my office has is the best source of data for. Every time there is an arrest, we open a case, and that is counted and organized in our data that we're publishing in on the dashboard, along with much else. So that will be coming very soon.
Thank you, Matt. Any questions or comments for our district attorney? Seeing none, thank you for your work on that and for the comedy with COMITY in working department to department. I think this is really important that we have a consistent approach across all our data dashboards. So,
yeah, I think that's going to show.
Okay. Well, moving on, Department of Emergency Response, and I see Michael Stitley is with us. Welcome.
Welcome, everybody. I don't really have anything directly, but I am going to ask Joe Milliman and Danielle Schwartz to just briefly talk about some training they took over this past weekend on our new CISM team. So if I could turn it over to them for a few minutes, I'd love to have that opportunity.
Yeah, so first I wanted to give a huge shout out and a huge thank you to Frank Krupa and Brenda Crosby from Whole Health, as well as Harmony and her team at Whole Health. And then Jesse Sputis was a huge help as well with some of the contracts for to get the training underway. But I'm happy to announce that we have 10 fully certified peer counseling members of a CISM team that can go out during major incidences and give some peer support to other first responders, both on the scene and through debriefing. We still have some behind the scenes work before we're ready to be deployed, so that probably won't happen until after the first of the year. But the big first step of the training is out of the way, and we have 10 very, very eager people. So a huge thank you to them, as well as those. I mean, this has been years in the making. We had a team in the past that fizzled out, and since then, every few years, they seem to have gotten together to try to get the team going again, and it, for several reasons, fizzles back out. So we finally were able to get the training in, and we actually have a waiting list of 15 more individuals that are interested in the next training. So,
Joe, could you just describe, tell them what CISM stands for, and maybe give some examples of when our CISM team would go out?
Yeah, so CISM stands for Critical Incident Stress Management. Again, it's a peer support team. We get deployed during major incidences. So whether it's a mass casualty MVA, car accident, or God forbid here at the airport, there's a plane crash, whether there's lots of fatalities, we can be deployed to the scene directly if it's going to be a long time that responders are going to be on scene and very mentally taxing on them. We can be there to do one-on-one peer support on the scene to help them. After the incident, within several hours, we will reconvene at a location with everybody to just kind of debrief the whole situation, not do a tabletop, not critique what happened, but more of what you saw, how you're going to process it, what you as an individual or you as your team is going to need for support moving forward. And then there's several follow-up meetings that happen after that as needed. So,
and just for the benefit of the committee, most CISM teams have representation from police, fire, and EMS, and they go out as a team. And some examples of when we might have used it here in the county over the last couple of years, we had at least 2 structure fires that had fatalities, and we also had some motor vehicle accidents where we had some incidents with pediatric injuries and even some fatalities. And in those instances, we had to reach out to neighboring counties that had CISM teams to come in and provide support to our local first responder community. So as Joe mentioned, we used to have a CISM team here in Tompkins County, and for various reasons, it just sort of went to the wayside, but we were very fortunate to have some of the leaders of that team that participated in the past meet with us very early on to provide some guidance that really allowed us to provide a foundation for the development of the new team. So this is something we're very excited about, and we feel that it will be used. And again, we're really pleased that we've had the support of Whole Health. And Something else I'd like to point out about our team that's a bit unusual compared to other system teams is that we had participants from whole health, mental health department trained with us. Typically, you don't really have that level of skill on a system team, so we're very blessed, frankly, to have Harmony and some of her coworkers that are going to be part of our team and be deployed with our system team to assist our first responders. Thank you.
Okay. Any questions about CISM? And I'd open it up to any other questions for Department of Emergency Response. I had a couple, but Veronica, did you?
Just a comment, this is really cool to hear, and the taking care of the trauma that may happen to the people doing trauma work and supporting others is just so important. And I'm really glad to hear you're investing in that and in a cross-department way as well.
Thank you.
Yeah, it's very near and dear to our heart. So we're excited. And like Mike said, we are one of the few CISM teams that actually have actual mental health clinicians on the team. And one of the other things that most CISM teams don't have is law enforcement generally tends to have their own peer support systems and teams set up. And although we didn't have any that were in this past training, we do have a few law enforcement officers that are on that waiting list for the next one. So we will be a fully involved, well-rounded CISM team once we're up and actually running.
Okay. All right. Well, thank you for that. I had a question. I had bragged on you guys at our last legislative meeting about the EMT training, and I was wondering if there's any update on how that's been proceeding.
Yeah. So they are currently roughly about halfway through their training. I believe that they're going to end shortly, right around the end, just past the new year. I don't have any specific updates as far as numbers go, but I have heard nothing but good things coming from the students that are in the class. So they are very much were excited to take the class, and they still have that enthusiasm that they're able to take that locally. So,
and is this a night course? Is this something you can take in addition to holding a regular job, or is it?
Yes. Yeah. So most EMT classes are designed for a full-time employee to be able to take the class as well. This class happens to be running Mondays and Wednesdays from, I believe it's 6 to 8 p.m. Right up at the hospital. Every class is a little bit different depending on how the instructor sets it up. So that times might vary for the next class that we hold. And some of them are even weekend classes. So that way you don't even have to worry about making it there after work or childcare after work or anything like that. So there are definitely options, and it is very much geared for the working individual. So,
and when this cohort gets done, is there a plan to do some advertising and do another round?
Yeah, so the original plan for this class was actually to be a paramedic class, satellite through upstate. And unfortunately, what the hang up this year was the lawyers dishing out the contract between Hugo Medical Center and upstate. They took so long to come to an agreement that they were no longer able to enroll the students in the paramedic class because that takes significantly longer than enrolling into an EMT class. So that's why they went with the EMT class this year. And unfortunately, again, because of how long it took, it was kind of a last minute. There was those that had enrolled were kind of more on a waiting list than they were actually enrolled, and they received an email about 2 weeks in advance that the class was a go. So they didn't even get a lot of notice. But this is something that we're looking to continue to do every year, or even twice a year if time allows. So not only will we be able to advertise further in advance, but we'll be able to set up a routine schedule so people will know that every August there's a class starting and that they can enroll in that if they so choose.
I just think that's outstanding. I'm glad we're paying some attention to this and really working on it. It's very good news. And I also, while I'm saying good news, I also wanted to mention Travis Collins. That was a very nice report of Dispatcher of the Year and his various accomplishments. It's good to read those things in the report. You know, and I also note, there was a dual report in the sheriff's report and yours about this incident where the burglary, the suspect crossed county lines, an armed robbery suspect, I'm sorry, not burglary. And, dispatch was involved in coordinating all of the efforts to try to locate this person. It sounded like that was a real team effort.
Yes, I just wanted to thank the sheriff too for reaching out to me not long after the incident, just to acknowledge our team. That was very well received, and the team really appreciated that. So I just want to make sure everybody is aware that the sheriff did express his gratitude to our team directly almost immediately after the incident.
Okay. Anybody else? Questions for Department of Emergency Response? Okay, doing great. Thank you. And we move on to Department of Probation and Community Justice. And I see Dan is with us, and there's Carla. Welcome. How are you guys?
What about the resolution?
We had a resolution.
Oh, I'm sorry.
We have two resolutions.
Oh, we got to go backwards. I went too fast. I was too happy with the news. We have appropriation from contingent fund, terminal pay, Department of Emergency Response, ID 12045. Thank you for, Ann moves. Mike seconds. Questions or comments? Are we ready to vote? All those in favor? That's unanimous. All right. And then we have a resolution in support of negotiating a memorandum of understanding between the county and municipalities within the county for a pilot rapid medical response system, ID 12055. And can I get a motion to put that on the table?
I'll put it on the table.
Mike moves, Lee seconds. Okay. I had proposed this, and I know we had a public comment at the beginning of the meeting regarding this. What this resolution would do is direct and authorize the county administrator to have conversation with the various municipalities that would be participating in the rapid medical response on how do we fund it. And as the committee members are aware, in our 2024 budget, we put in half of the cost of this program into the regular budget, but we also put the other half into contingency with the idea that if we are unsuccessful in getting the grant, we wanted to be able to have a mechanism if we needed it to go forward. But in the meantime, the purpose of putting it in contingency was to really have negotiations with the other municipalities. And I feel this is important for two reasons. One is it does make sense to me that we do have some sort of cost share that the residents of the county who are getting the principal benefit of this new service help to fund it in some measure more than other members of the community who are not seeing any benefit. And I know that there were various arguments about that, including that some people out in the residential or the rural areas are some of the poorest people in our community. But I think that's also true of people who live in our city, that we have a lot of very poor people in the city of Ithaca who pay a lot of property tax through their rent when they may not even understand that they're doing so. And we should be looking out for their equity as well as the people in the more distanced communities. But the other reason that I would like to make sure we consider and have a discussion about cost share is that what we're trying to do is to provide an enhanced level of service. And if we have no memorandum of understanding, there will be no commitment, written commitment, maybe there'd be informal ones, but no commitment to maintain the current level of services at the various towns and villages where they are providing emergency medical response. What I would really regret having is that the county starts funding this and various towns reduce their services as a way for them to save budget money. And we don't end up with a net improvement in the overall system, which is what we're trying to accomplish. And without a memorandum of understanding, there really is no formal way of making sure that happens. So that's why I put the resolution together and asked for it to be put on the table. I'd welcome discussion. Mike.
My big question is this last line in the result. I mean, I don't mind having the discussion with the towns. I don't think I'm not overly optimistic about it. And I want to see this thing happen anyway. So my question is this second resolved where you go, shall approve the memorandum of understanding prior to commencement of the program, basically. I'd like to cut that prior to commencement of the PRMR, just because, I mean, I want to get started on this. And that to me means that you'll go negotiate, and that could take 4 months. I mean, I don't know how long it's going to take, but the holidays are coming up. I mean, that puts us in late. And I mean, I'd like to see us, get the trucks outfitted, start hiring. I mean, I'd like to
I'm in agreement with you there. I think we've all said that since this summer when we started talking about this. My concern is that if we proceed, we start without a memorandum of understanding, we may never get one. And what do we do then?
Well, it is a pilot. So,
yeah.
I mean, it's a 2-year pilot. And so that does give us some negotiating there, but I mean, if Enfield's already out, I don't know if they are, that's just Robert talking that way. Lansing seemed more inclined. But it can't be like an all Lansing show either, so.
Okay, what do you guys think? Lee?
All over the map on this one.
Okay.
Because I don't want to see an impediment to, I think it started the first of the year is practicable thereafter. And I have heard back from one of my town boards just after passing a substantial EMS contract with their local department, trying to figure out what this would mean to them, and very similar sentiment as Councilman Lynch expressed earlier. I see things from a little broader standpoint. There's a huge discussion going on in Albany in an attempt now, and a serious one, to define emergency medical services as an essential service. And it stands a good chance of getting through the legislature. But it's still pretty ambiguous as to what that would mean. But it will, if it was to succeed, it's going to assign some level of responsibility to some level of local government to ensure that EMS response occurs. I don't know that that's going to happen at the county level. I think it probably would be directed towards villages, towns, and cities. And there may well be an implication coming on for the towns to consider. And I see this having a strong move. So that may factor into what this may look at. The other thing is it may also be so general in nature that it defines it at a basic life support or a first response level. It may not go to the extent. We've got just, again, I spent years working on this and have pushed certain pieces of legislation through the state fire chiefs and the allied fire services. And one of the things that's becoming clearer and clearer that commercial ambulance services across the state are withdrawing service in particular areas. They're declining to respond to rural areas in some cases because of the loss of money. And it all has to do with the financial modeling that's behind them. Cayuga County is about to lose a major provider who just says, we can't afford to be here anymore. And their towns and fire departments are now struggling with an answer on January 1st. And my point to all of this is that it may be coming where the commercial services or those that are providing broad coverage are going to go to the municipalities and say, in order for us to continue to respond, even at an ambulance level, you're going to have to contract with us in addition to allowing us to bill the patients for service. Big move coming. So I'm trying to think how to structure a cost sharing, and at the same time, let the towns and villages know that they aren't completely off the hook yet on this. They may be mandated to provide something that they're not doing today.
Yeah,
Very serious discussion.
Yeah, I've tried to parse out what the proposed state legislation might mean. And I can't figure it out. You might be right. It might be that it's going to shake out that the counties will be given this responsibility. And in some sense, doing it on a county district wide basis might be more rational, but I'm not going to hold my breath for New York State to be rational.
No, and the other part is that you've got some strong efforts happening with it, especially with our assembly member and a nearby state senator that would create a funding model based on a CHIPS program. They think it's viable and it may very well pass, which would also factor into this in that it probably would be directed toward municipalities that are in fact allocating funding for EMS purposes. So there's a lot at play here, and it's not just at this level, but at the statewide level, and I think you're going to see something happen. So I'm trying to think through the implications of what this resolution means against a broader effort and some changes in funding streams that may well happen here before the pilot's over with.
All right, Anne, I think you had your hand up.
Yeah, thank you. A couple of things. First thing I want to address is what my colleague, Mr. Sigler, mentioned regarding the last resolve, the prior to commencement of this, the PRMR. If Mike wanted to propose an amendment to take that out, I would second it.
Cool. Let's do that.
Deal with that
It's not gonna be
first, and
friendly.
I have.
Well, would you just take it out?
Just
Because
that one.
But then what, I was looking at that and saying, maybe we could take that out, but then what does it mean? The county administrator shall report back the results of that negotiation, and the legislature shall approve the memorandum of understanding, or did you take it back that she just reports on negotiation?
Yeah.
Which doesn't really mean anything.
It means something, it just takes out the,
I do note that we have money in contingency. We're going to have to vote on that issue. Does it make sense to make that the trigger? That the county administrator gives us some report on status of these negotiations? Maybe she says we can't get there before we vote to take money out of contingency. I won't feel comfortable taking the vote without asking her in any event.
Right.
Would that be a reasonable?
I'm personally gonna vote against this whole resolution.
Okay,
But I would want, I have reasons for that, which I can go into later if you want, but
let's talk about
right
this
now,
language for
just
now.
talking about this part, I don't want it, these negotiations could take a while. I mean, how are they gonna be done? You have maybe one or two municipalities that are gonna jump in and then others aren't. This could take quite a while.
How about the county administrator shall report back the status of that negotiation regarding a memorandum of understanding prior to the legislator's vote on the contingency fund? That we'd want to know, where do things stand at the very least, so we have some.
I think the question's gonna be asked anyway, so. But Veronica's got her hand up.
Yeah. Doing that feels like we're sort of like that we don't trust some parties in this situation. I don't know if it's municipalities. Surely it's not our county administrator to go through with this and report back. And so we're holding the start of the program in collateral until they do. I don't think we need to do that. I think we can just pass a resolution if we want.
It becomes somewhat toothless, but.
Well, do we relate to our municipalities with teeth?
Well, I think we want to be clear what we want, and if we're giving something of value to other municipalities, which we are, substantial value, we should be clear of what we're asking for in exchange. And I don't think that's unreasonable or unfair or anything else. That's our job as legislators.
I'd love to push back on that, but it kind of gets beyond the do we have an amendment on the floor, actually? Or are we just in the process of trying to construct one?
I think we were trying to figure out what the language would be in that last resolution. But yeah, if somebody wants to make a specific amendment, we can take it to a vote.
Well, there is an amendment on the floor, which is
What
to
if you
take
could
it out,
restate it?
or would maybe another, if you want to put a time frame in there at the end of the pilot, the 1-year pilot.
I like that, but that's a big jump, and I mean, that's saying that, yeah, we're gonna fund this, which I don't have a problem with.
Which we may not. I mean, hypothetically, we might not have the votes for taking the money out of contingency, but yeah, you could do that.
I mean, I don't really want Lisa going every town. I would like her to go to the town, the council that meets and just say, what's your take on this? I mean, I'm not overly optimistic. I mean, I've talked to there's not that many towns because we're excluding so many.
I have had a conversation separately with Dan Klein, who has been speaking to representatives from the various towns, and he's indicated that there is some receptivity to this.
Okay.
There's not in my district. Ulysses, Enfield, Trumansburg. I haven't spoken with the town of Ithaca. I also have a little part of that. So even though Trumansburg will not be included, the actual village, but because it's the town of Ulysses, they will be. So, and under some of the scenarios that we've been given, Ulysses was even excluded, and some of them from possibly chipping in. But anyway, none of them are for contributing, and they think the county should do this, do the service, because anyway, I can go into various reasons, but they're not receptive in my area. I don't know where. I haven't heard of any municipality that is receptive to chipping in.
I've heard otherwise. I've heard that the town of Lansing actually.
No, they were receptive.
Yeah.
No, I said that.
One.
And Dan Klein actually said he had some productive conversations with people from the towns you mentioned. So I don't know.
See, I don't think we lose all of our bargaining power though, because again, it is a pilot. So after 2 years, we can say, listen, this is great, but it's expensive and we need help with it.
I guess I'm concerned and again, I've stressed over and over again, we are one county and we want to do this as a one county effort. But as with other municipal services, such as say a water district, you have the fundamental principles that those who benefit should pay, and those who do not receive the benefit, you need to protect. And we're not doing that here if the county pays for the whole thing.
I could make that argument against any road that we put in.
It's an imperfect solution, but you have to make those specific references every time you do a water district. And this is similar to that, that you are taking city people who are paying for services that do not help them at all. You can argue that structurally it's making the overall system more resilient, and that's good, but this is improving response times for very specific areas of the county. And with a 50-50 split, you're taking some of that cost and you're applying it to city people, even though they're not getting a benefit. But the other half that we're talking about in this resolution, you address it to the people who benefit. I don't know who is first. Veronica, go ahead.
Yeah, thank you. Well, for one thing, I do believe it seems very likely that the overall system will be strengthened by the program. I keep wanting to call it the PERMR. It says PRMR. And so that city people will benefit in a way that's not equally quantifiable. Or sorry, not clearly quantifiable. But if we're talking about equitably allocating the costs, I'm looking, there's a phrase in here saying that we want to equitably allocate a portion of the cost to those residents who will receive the benefit. I think that makes sense if the status quo is equitable. And what we're trying to do is give some added benefit to just some residents. And in that case, maybe, yeah, just those residents should pay the cost. But the status quo is not equitable at all. I think we saw those like glaringly long response times in some parts of the county. And I don't think it makes sense to say, hey, like residents over there, you all have to pay more in order to get maybe something close to what the rest of us already have. And I represent a district in the city. We'll see if I get yelled at, but I do. One of the things I love my constituents for is many of them express care about other situations. They say like, yeah, I'm comfortable, but I'm worried for the community that others are struggling with this, that, and the other.
And
Yeah, I appreciate the example you gave as far as like a water district, but I think a better scenario or a better something similar would be our sheriff's department. Water gets delivered right to a certain house, on a regular basis. But, so I'll take, say the town of Newfield, where you have Route 13 coming through, you have a lot of people in commuting every day. People have motor vehicle accidents, people work here. There's a lot of different services. People are mobile throughout the county. And so to charge certain areas because there might be more of a response, we didn't do that with 911 services so far. We haven't done that with our sheriff's department. I mean, this just like the sheriff's department, that benefits the city and the whole county. New York State Police don't bill us for whenever they come into our county. It's just here, to help us out as we need, just like was talked about with the armed robbery suspect who came into our. There was a lot of different municipalities or a lot of different services that were mobilized, and you don't get, oh geez, have they paid for this? And I don't want to get into that. If there's an issue, we need to go out. We go out wherever that is. There could be a time where Bangs doesn't. There's probably going to be a lot of times where Bangs ambulance doesn't have to go out because something else is covered by that. And when Councilperson Lynch spoke about the Enfield, I've been to the Enfield, the emergency response, their fire department. They have a vehicle, but they don't have the staff. They're all volunteer. So for them to pay $50,000-$60,000 is ridiculous when they could do it some other way. So I just don't see that this is equitable when you're trying to, the more you slice and dice it, I think the less equitable it is. I see you trying to do that, but I think just like when we asked New York State, to provide a service, when it gets shared more throughout the state, then I actually think it is more equitable. So I'm going to be voting for this whole thing, and I don't think we can ask them to put in writing that they're going to maintain their services. I just don't think that's fair either, or something that they can commit to. And then we're going to have half of the municipalities paying in that we put on the list. And then so we'll say, okay, we're just going to say Enfield because you haven't signed on. So we're going to take you off the list. I just don't know how that's going to happen.
I guess I'd just take a moment to respond to some of that. Compared to other government services, this is inherently geographical. It is entirely built around response times to various places in the county. If we were looking at the city itself, we would never be having this discussion. Nobody would be talking about a rapid medical response because it's not an issue for these residents in the city. And you also have, you said you don't think we should even have a memorandum of understanding that commits to current service levels. There already has been discussion among various volunteer fire departments about they're afraid their services would get cut if the towns were asked to pay anything. Without a memorandum of understanding, that could well happen. But if the answer is, well, we'll just do it without any memorandum of understanding, any commitment on service levels, I think the temptation will be there for financially strapped towns to cut service. And what have we accomplished then as a county? We haven't done anything. We have no enhancement of the service if that happens. I find that really weak tea. But it sounds like I'm outvoted here. I guess let's get the amendment in place that you guys want. And we'll take it to the legislature, see if we get a different result there. And I know, there's fewer city reps than non-city reps, and Veronica thinks this is okay. So you'll probably prevail there. But I don't see it as fair or productive, the path we're going down. Mike?
So I just want to take out that second resolve then.
Okay, that's the motion.
Yeah, I mean, that'd be the easiest.
Okay.
She'll still negotiate. Lisa will still negotiate, and we'll see where we end up. And as I've said, it's a pilot program. I mean, we could end it after 2 years. So.
Okay, and you seconded that?
I don't know if that's what she seconded, but if
You're
that's
taking out
acceptable,
you're proposing taking out.
I would just knock out the whole second resolve.
The whole final resolve, just the last
Yeah,
paragraph.
because the first resolve directs the county administrator to negotiate an amount.
Well, the second one,
determine-
the first resolve says that we're gonna determine the service levels and the allocation of the remaining 1/2 of the estimated operating expense. So that kind of is almost.
Right, she might come back and say, yeah, they're not digging this, or hey, yeah, no, they're gonna pay half. But either way, we've got the money in contingency. So once that's assessed.
Okay.
And this doesn't prevent us from moving forward, I think.
All right, I'll second taking out the last resolve.
Okay. Ready to vote on the amendment? All those in favor? All those opposed? All right, 3-2, the amendment passes. All right, further discussion on the resolution as amended. Mike.
Sorry, you can go ahead.
I'd like to offer another amendment. I'm not really optimistic, but it is for the reasons I already said before, to cut a couple of phrases. One of them, lines 23 and 24, I'd like to just cut and further wishes to allocate the financial burdens and system benefits of the PRMR to county residents on an equitable basis. And then I'd also like to cut in lines 33 and 34, the clause and to equitably allocate a portion of the cost to those residents who will receive the benefit.
You want to take those together or separately in terms of an proposed amendment?
Together, one amendment doing both. I think they're kind of equivalent.
Is there a second to remove that language? I'll take. Okay, can you repeat that, Veronica?
Yes, so I'm trying to remove 2 clauses, I guess, each of them bounded with commas. One of them is line 23 to 24. And the part I want to remove says, and further wishes to allocate the financial burdens and system benefits of the PRMR to county residents on an equitable basis. And then the other one I want to remove is in lines 33 and 34, the part that says, and to equitably allocate a portion of the cost to those residents who will receive the benefit.
Okay, and Mike, you seconded?
I do.
Okay. Yeah.
Oh, no. They're thinking. Thank you.
Presumably thinking.
We're not frozen.
Yeah. No, that's okay. Bye.
Were you ready to discuss? Veronica, did you want to speak to your amendment or?
I pretty much already said why.
Lee?
I'm trying to follow what Veronica's proposed here, and I think I'm okay at this point. And it really comes down to, in order to ensure overall enhancement of the emergency response system, taking out that next line, it is necessary. Did we change that word, Rich? I circled it because we talked about it earlier.
Which word?
You're tempting me, but that was not part of the amendment.
34. No, but you were asked about that, whether we would change that word necessary to negotiate. Did we do that? Or
no?
Okay. And I'm not proposing that we do it, because I think there's a conversation that needs to take place amongst all the parties to determine what they think the level of services should be in their communities and what their long-term commitment is to achieving those. You're proposing, Veronica, to continue to have a period of discussion, negotiation, and move toward a memorandum of understanding with this amendment.
Yes, to the same extent we were before, but just not for a reason that we, in order to have cost sharing that's like different among different municipalities, but more because it's worth having the conversation and to get a shared understanding that somehow overall service will not be like reduced or held constant.
Mike?
I mean, basically it's the equitable part that yeah. I agree. So, because we really, I mean, I understand what you're saying about the water thing, but like, we really don't do it that way. Like, we just never have. Like the library, for example. Yeah, that's not an equitable thing for the rest of the county. I mean, there are certain things we just do as a county, and yeah, they're not going to be equitable. And we do a lot for the city that's not equitable from the towns. And we've always been warned, don't make this into a city mouse, country mouse thing. At least I have been warned that. So,
well, this looks like it's heading in that direction.
I don't know.
Okay.
I mean, to think that the city's not going to gain any benefit from this, I don't think is true either.
I guess I'm going to oppose this amendment because without cost share, I don't know how you negotiate service level commitments. You know, that we are just paying, they have no incentive to agree to any service level commitment other than just saying, well, oh, sure, we'll do it. I don't think they will. At least not all the towns that we want to participate. We need a unified system. And if our goal is to build a better emergency response system, you would want a unified approach where everybody's pulling in the same direction. And we seem to be just going in the opposite direction, saying we're not going to ask for a commitment from anybody for anything. We're just going to.
We don't do that for the sheriffs, for public safety either.
And I think there's significant issues historically with exactly that city people are very resentful of paying county tax for a sheriff's department that historically hasn't been doing patrols in the city. They don't provide a benefit. And I say that's changed recently because of significant issues with staffing levels at the IPD, that there's been some coverage. But I'm not sure that's a good example to raise.
Well, what I was referring to more was the municipal, the public safety departments in the other municipalities too.
I didn't get your point. I'm sorry.
Besides Ithaca, there's several other municipalities that have their own public safety departments. Trumansburg, Groton, Cayuga Heights. I don't know if there's other ones off the top of my head.
All told in the county, yes.
But they don't all have police departments, do they?
No.
Okay, yeah.
Some do.
Great.
All right. Any further discussion on the proposed amendment? We ready to vote? All those in favor? All those opposed? 3-2, the amendment Amendment passes. Okay. Anything further before we consider the resolution as?
Well, now I don't know if it's gonna make it out of committee. We'll see. Well, it's already been moved, right? It's already been moved.
Yeah, you put it on the floor.
So I'm gonna vote for it out of committee because I'd like to see what the rest of the legislature frankly thinks of it. So, you know, I don't know how I feel about the entire resolution. I mean, I would like to hear other input, since you are saying that the city folks and the county folk or the town folk won't get along. I don't think that's true, but we'll see. Not that that's really what you were saying. I'm curious, so.
I want to see the conversation take place. I want a serious discussion about what the vision of emergency medical services is between all the municipalities. I'm not sure I'll vote for this in the end at the legislative level, but I do want to hear what the other legislators say, and I do want this conversation to be taken seriously, either by the Council of Governments or a group that Lisa can put together. They need to know the seriousness of the system and be willing to work with us to invest in it, to ensure there's proper coverage. And you know, I don't want to be an impediment to rolling this out on the first of the year, but let's be serious. We're all in this together. So.
Yeah, and I'm certainly disappointed. I feel like the negotiating strength for our county administrator has essentially been gutted, but I too will vote to send it to the full legislature, and I'll be open and transparent on that. I think I'm going to try to move to have these stricken matters put back in.
Yeah.
We'll see. Okay. Are we ready to vote? All those in favor? All those opposed? 4-1. All right. So it goes on. We'll see.
It doesn't even go on the consent agenda. This is terrific. Job, man.
Yeah. Okay.
Someone would pull it immediately.
Anything further for Department of Emergency Response? That was fun. I think we're up to probation, Dan and Carla. Sorry to give you the start and the stop there. Welcome.
Thank you. Good afternoon. I'll keep it brief. We did hold our third and final DWI Victim Impact Panel of the year last night at the courthouse. I wanted to thank Legislator Pilar for attending. I'm sorry that you got stuck at the door and almost didn't get let in.
I'd like to thank you for getting me let in, even though I was a minute late.
You were fine. I'd also be very interested in hearing what you thought of the panel at some other time, or now if you feel like talking about it. Other than that, I don't have any announcements this month.
Certainly the one I attended, I thought was really powerful. That was hard at moments to listen through. Yeah, very good. I think it's a good positive program to have the victim impact panels. Is there anything you wanted to add, Veronica?
Yeah, I would agree. I thought it was really good, very, impactful on me too. And it was a good mix of, I kind of thought it would just be one speaker, but it was a handful of speakers, both from like support organizations locally around like alcohol abuse and addiction. And then the longest presentation from someone whose daughter was murdered by someone driving a vehicle while very drunk, who was a phenomenal speaker, and grateful to him for sharing his story. And then someone who is an alcoholic in recovery for a decade now and sharing his story and how he got to where he is now, which is also really powerful.
Well, thank you for the feedback.
Anything further for our Department of Probation and Community Justice?
I don't want to steal Lance's thunder, but I'm going to get that lottery ticket. I'm all finished. Take it away, Lance.
Sorry, everyone. Hello, everyone. That's kind of a private joke between Dan and Matt and I. on that. I just reiterate my last comment to you in the emails, Dan, that I sent you. I'll be quick. I see the time. I don't have anything really further to update you on. I'll probably have more in December. I would like to take just a minute and share a very quick kind of story. You know, we spent a lot of time talking about reimagining and implicit bias, you know, all this work we do, and why it's important because of the, you know, implicit bias in our system, but the implicit bias from society that comes into our system we deal with. And, you know, I want to give credit to Matt's office here. We had a petty larceny case that I actually handled in city court. And when the facts, everything became known, I think they did the appropriate thing. They immediately dismissed the case because of the nature of the case. This was a young woman of color, a freshman at Ithaca College from Vermont, had gone into a big box store, had been shopping, had a bag from another store, and, you know, very smart. She said she realized she was probably being profiled right away because the security people started immediately following her. She went to the you know, the self-checkout. She's checking out. She paid for 9 items, actually turned off the machines on her, and ultimately charged her with petty larceny. It got a little involved, so it came into court. I think when we documented everything, we looked at everything, Matt's office said this is inappropriate. She actually hadn't committed a crime yet. But I think what struck me was, you know, after I talked to her and the importance of why we do this and what we miss sometimes, this, as I said, was a very kind of poised, reserved young woman. And I was talking to her, my students, in she was actually in tears at some point. You know, she was talking, she'd never had any involvement with the criminal justice system. She ended up getting handcuffed. And then she said, you know, I'm going to finish out my semester here, but, you know, she said, I really question whether I'm safe in this community and whether this community wants me to be here. So I said, I'm not sure I'm coming back to school, to Ithaca College, and, you know, for the, you know, after this. And I kind of talked to her about that, but I think we forget sometimes when we're working in the system, the impact some of these processes have on people. And that's why I thought I'd share this story. You know, just a little reminder of why we do this stuff. And I think credit is due to Matt's office. You know, I can even say in this county 20 years ago, or when I started, there probably would have been some prosecutors who would have not recognized what was going on here, in other counties too. But I think it's just a little reminder. We bang our heads a lot of times trying to improve things, but there's a reason why we should be doing it. That's all I have.
Thank you, Lance. Matt, did you have any comment? Don't have to.
No, I appreciate that Lance said that, and that's what we try to do is you know, be aware of the overall circumstances and you know, do the right thing. And that's what my responsibility is in my office, is to do the right thing, not to prosecute people when it's not appropriate.
Well, I think we're fortunate in the defense counsel and the prosecutors that we have in our community. I think we take a careful look at things most of the time. It's good. Yeah. So thank you, guys. Any questions or comments? Veronica?
Yeah, just wanted to add my thank you, Lance, for sharing that story. Because I think it is, you know, I don't necessarily think about the impact that the law enforcement system involvement can have on someone, even if at the end, there's no record, no charges are dropped, or no charges are held, whatnot. So I appreciate you sharing that with us. I also want to share, I think the first conversation I ever had with DA Van Houten was partially about this kind of issue, that the trauma that you know, criminal justice system involvement can have on someone, even if they don't end up being prosecuted. And I just want to thank you, Matt, for your openness and awareness to that kind of thing. Yeah, I think we're lucky to have you as our DA.
Okay.
That's
Anybody?
just if I could just take a real quick second to plug, in about 20 minutes, I'm going to the community book read that is put on by the URO, the Ultimate Reentry Opportunity, and it's of this book called My Grandmother's Hands, and it's about trauma, racialized trauma, and the pathway to mending our hearts and bodies in the criminal justice system specifically. So I highly recommend that book for anybody who is interested.
Which reminds me, if we can go back to the chair's report for a moment. On recommendation of our legislative chair, Shauna Black, and our county administrator, Lisa Holmes, I went and got Corrections in Ink by Carrie Blakinger. And it's a very powerful read about criminal justice in our community and drug addiction and a path through it, which ultimately is, given what you read, it's really nice to see that she made it through, but worth reading. Anyway, book reports.
Seconding that, I also looked it up after Shauna talked about it.
All right. I think we're,
One more thing, can we clarify the date of our next committee meeting?
yes, Brittany?
Yes, so the next public safety meeting is scheduled for Thursday, December 14th at 3 p.m.
Okay. And that's because we want to be able to take action at our meeting and have it covered at the last legislative meeting of the year. So we've moved our meeting for next month. Okay. Is there any other business to come before the Public Safety Committee? Seeing none, I would entertain a motion to adjourn. So moved, seconded. All those in favor? Aye. We're adjourned. Thank you, everybody.